Actually, there was this young girl, and
Acha.
she had met with an accident in which this iron rod had gone deep into the brain.
And what was the
And
age of this girl?
She was in her 10th standard, I guess. She was brought to us in a comatose condition, actually.
Oh my God.
And we had to operate her in emergency. But she's able to do her activities of daily living, and she's independent. So that's a nice feeling for me.
So how long was this rod, and what weight are we talking about?
This was, I think, 26 grams of the weight, and it was a rusted iron rod. It was done under a microscope, and she was bleeding. There was a depressed fracture in her skull. And she has finished her 12th, and she is now past 12th standard with flying colors. She was brought to us in a comatose condition, actually.
Can someone really go home the same day after spine surgery? I know it sounds too good to be true, but can they?
Yes, but it is, yes, definitely possible.
Spine surgery is always the last resort. Myth or fact?
Myth.
If my MRI shows a disc bulge, I need a surgery.
Myth. All discs do not need surgery. Like I said before, only 10% of them who have not been responding to the medical treatment or is a neurological deficit, only those are the patients who require surgery.
Back pain may be a common issue, but spine surgery isn't something that anyone takes lightly. Today, we are exploring a game-changing advancement that's transforming how spinal problems are treated. Yes, we are talking about minimally invasive spine surgery. With smaller incision, faster recovery, and less trauma to the body, MISS is redefining what's possible in spine care. But what does it really involve? Who is it right for? And what should a patient expect out of it? Joining us today is an expert neurosurgeon and spine specialist who is at the forefront of surgical revolution. Dr. Rahul P. Modgi, a senior consultant neurosurgeon and a spine specialist at Sahyadri Super Specialty Hospital, Nasik. Dr. Modgi brings over 18 plus years of experience and an exceptional track record of more than 6,500 successful surgeries, which involves brain as well as spine. His name is synonymous with surgical precision and clinical excellence, earning him 3 gold medals, including the prestigious Padma Bhushan and Dr. Ram Murthy Gold Medal. Dr. Modgi's remarkable feat of removing the largest and the heaviest iron rod from a brain earned him a place in the Limca Book of Records in 2014. With multiple national and international awards to his credit, he is here with us today to share insights into the evolving world of minimally invasive spine surgeries. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Rahul P. Modgi. Hello sir, how are you?
I'm fine, thank you.
Welcome on Sahyadri Health Talks. And I was just going through the profile of yours when I was giving the introduction part of it. And I just saw that you have a, Limca Book of Records in your name in 2017. So first of all, congratulations on that. So today's topic is, MISS, which is minimally invasive spine surgeries, and we are going to talk about it. But before that, narrate us that story, because it was quite fascinating, when I read that you removed an iron rod from a brain of a person. So, tell us about that story before we dive into it.
First of all, thank you for noticing it. And,
it was worth noticing. I mean, I don't know how I missed it before.
Actually, there was this young girl, and she had met with an accident in which this iron rod had gone deep into the brain.
And what was the age of this girl?
She was in her 10th standard, I guess, and she has now we just met her last week, I guess, and she has finished her 12th, and she is now past 12th standard with flying colors. She was brought to us in a comatose condition, actually.
Oh my God.
And we had to operate her in emergency.
Achha.
She has a residual weakness though, but she's able to do her activities of daily living, and she's independent. So that's a nice feeling for me. And then when we searched the web, it was the longest and heaviest rod being removed from the brain. So that was the record part of it.
So how long was this rod, and what weight are we talking about?
This was, I think, 26 grams of the weight, and it was a rusted iron rod. So we were worried for the infection, actually. But luckily for her, with God's grace, everything went off well, and she came out without much of a deficit.
So how was it seeing it in that seeing the case?
It was done under a microscope, and she was bleeding. There was a depressed fracture in her skull, so we had to separate the mud particles of it, and then after cleaning the wound, and we had to take her up for emergency surgery, from which the rod was removed. So that was the surgery part of it.
So how was the sense of achievement after the patient walked out?
It was a nice feeling. She had a STOMY post-operative course though, ventilator, tracheostomy, and 2 weeks or so. So those 2 weeks was STOMY, but after that she showed good signs of recovery and she went home walking. So that was a nice feeling for us.
Well, lovely, and we are very happy that a patient who needed such complex surgery landed up in right hands and was almost a new life which the patient got. So moving on to today's topic, which is minimally invasive spine surgery. While the terminology itself is quite self-explanatory, what it says, but still, to begin with, I want to understand that what are these minimally invasive spinal surgeries, and how does it differ from the traditional ones?
Yeah, as you rightly said, the word itself is self-explanatory. And minimally invasive, it's almost a scarless surgery, or you can say a keyhole surgery. And like in other branches, we have endoscopy, laparoscopy. This is a surgery for spine, and in which there is this small incision, less of a dissection, painless, precision, and good post-op recovery. In fact, patient can walk home the next day or so. So that is the best part of it. And the patient needs to be selected well. That is the only criteria for this.
So when you are talking about patient selection, right? So what kind of patients are apt for MISS?
Yes, actually a single level unilateral disc, a young patient who is a working individual who needs to go to his work immediately or does not afford to have more of a leaves. Those are the right candidates for surgery, because and unilateral disc is easy for us to access through the endoscope, microscope, and those are the rightly selected patients, I must say.
So, what type of cases and of spine surgery you have treated so far through MISS, and which have done beautifully well? Just because the procedure or the technique was better, rather than going for an open surgery?
Yeah, the commonest indication I would say is still sciatic or a slip disc, prolapsed intervertebral disc. Secondly would be a lumbar canal stenosis, wherein along with the disc there is this ligamentum flavor hypertrophy, facetal hypertrophy, or spondylolisthesis, and now we are upgrading ourselves to unilateral spinal cord thecal tumors, intradural tumors also sometimes.
So what kind of technology or technical advancements are we using here?
Minimally invasive, yes, it requires technology. It requires what we call as a dilator, serial dilators, and we have with us our armamentarium and also endoscope and a microscope. So depending upon the surgeon's comfort and the patient's requirement, we use any of them. So minimally invasive consists of these three components actually: endoscopy, minimally invasive microscopic surgery, and dilator induced therapy.
Okay. So suppose if today, I'm a patient who needs a minimally invasive spine surgery, and I'm someone who has never heard of it. So what would be, few questions which you would recommend every patient to ask their doctors when they are recommended for a MISS?
Yeah. Firstly, obviously, patient comes with an MRI done, and we are on the MRI. We are able to locate, or we can say localize, whether the MRI is matching with the patient's symptoms. That is I must say, the first and foremost indication. Because sometimes there is a mismatch in patient's clinical condition, the presentation, the neurological symptoms, and the clinical examination. If those matches with the radiology or the MRI, he gets the best of the results. So firstly, the patient should ask for whether an MRI has been done for him, if the MRI symptoms matches with his clinical symptoms and his expectation after surgery. Second thing, the availability of the equipment, of course, and the surgeon's experience.
So, walk us through the procedure. Like, all we have heard is spine procedures are usually very complex and requires long hours, probably 8 hours or 10 hours, and so on. So, how does spine surgery, which is minimally invasive, from a patient's perspective, walk us through the entire surgery?
Yeah. After the initial workup of patient, like I said, MRI, clinical examination followed by MRI.
Yeah.
And once the pre-op fitness has been done, the surgery is done in prone position with all the bony prominences protected.
Achha.
And usually it is under general anesthesia.
Achha.
Though the surgery duration may be 1 to 1.5 hours.
Achha.
Nowadays people are doing in a local anesthesia also. But
so we are talking about spinal
spinal or regional, yeah.
Or regional. Okay.
But we would still prefer general anesthesia because of the surgeon's comfort basically, and anesthetist help. So we use this CR marking for the level L4, L5, which is the commonest level, or L5S1 in the lumbar disc. And once that is located, we put a serial dilators, and once the dilators are inside, we again check the level for the surgery. We confirm the level, and then with the whole help of microscope, once the level is confirmed and the bone is drilled off, we reach the flavum and the disc. Once the disc is reached, we remove the prolapsed disc and the nerve, which is extremely compressed, swollen, tender and inflamed. That gets relieved instantaneously, and we can see it through our microscope beautifully well.
That the pressure is released and the nerve is slowly getting better.
You can actually feel, the patient relief once you while doing it also.
Okay, must be so satisfactory, right?
Exactly.
So post surgery, so as you said that from a duration of maybe 7 to 8 hours of surgeries, because of MISs, it has reduced down to a couple of hours. So post surgery, how soon is a patient able to walk, or how long is the hospitalization?
Yes, actually we aim for the patient to be mobilized either in the same day evening or maximum the next day.
Achha.
It also depends on the patient tolerability, the patient anxiety.
Also the age and...
exactly, yeah. It is multifactorial, but yes, it's definitely earlier than, because the duration is less, the mobility and the surgery post-op things are less than what it was before a few years back.
So the patient is practically tried to, mobilize on the same day or maybe a day after the surgery, and followed by how many days of hospitalization do we see?
Hospitalization, we send him within 48 hours because of maybe insurance requirements also. Yeah. But otherwise, patient can go home the next day itself, and we send him home walking.
Achha. So the patient walks out of the
and this is sort of prepared. His mind is prepared for this.
Achha.
Before the surgery, we show him the MRI findings, the procedure we are going to do, and other patients' testimonials, so that he is mentally prepared and for the physiotherapy.
So he knows what is he getting into.
Yeah. So that makes him a little more comfortable for his surgery and his perioperative recovery, and of course the back to home ability.
So yeah, definitely one of the most important factor in any form of spine surgery, or for that matter any other surgeries also, is the post-operative rehab, which is a physio. So what role does it play when it comes to spine surgery?
Yes, single level disc, like I said, we discussed, the same day or evening or the next day morning, patient is able to sit up, walk with a belt or if required.
With the walker.
And if it is a 2-level surgery, it's a little bit more of a rigorous physiotherapy, first in bed and then gradually stand up with support and walker if required, depending upon the age of the patient, the pathology and the intraoperative findings. Elderly patients sometimes take a little more time depending upon their cardiac activity or age, osteoporosis, other multiple things like knee degeneration and all those things. So, but still patients are able to mobilize faster, able to send them home, and the cost, the expenses and the other things also do fall in place.
Okay. So when we talk about the entire process of a minimally invasive spine surgery, like any other processes, every surgical approach has faced certain level of challenges. Are there any challenges which we face in MIS?
Yes, definitely. Any surgery, there are challenges, because I must say there is no surgery without challenges. It would have been the challenging field, of course.
Yes.
But then as you graduate more, your learning curve decreases, your experience increases, these complications and this problem shooting falls off.
Achha.
The most common things, of course, is sometimes we have a dural injury, CSF leak, which we are able to manage by either suturing it.
So what percentage of cases are we talking about?
Initially it was more, but as the learning curve reduces, our experience increase is now less than 10%.
Achha.
And that is also, we can manage it intraoperatively itself. We can suture the dura, we can put glue, and since the muscle dissection is less, the muscle cover also takes care of the dural injury part of it.
So I'll tell you why I'm asking you this question is because one of the very common belief that a layman has is just like how complex brain surgeries are, spine surgeries are equally complex because there's a common belief that idhar se udhar thoda hoga and you'll be paralyzed for the rest of your life. So I just wanted to send out this message that yeah, there are challenges in MISS as well, but then these challenges are very well managed, and it's not that these are irreversible.
Yes.
Or something like that. So on that note, if you have to give a message out to somebody who is petrified with the word that they have to go for a MISS
Yes.
and they have to get it done, what would that message be, and how do you convince such patients that rather than doing an open surgery, go for this because it is more advanced?
It's a nice question actually. It's a very common thing for patients to get sort of confused rather than petrified. बिकॉज इनिशियली पुराने ज़माने में ऐसे लगता था लोगों को कि स्पाइन सर्जरी मतलब पैरालिसिस होना ही है, ब्लैडर बॉयल मतलब पेशाब संडास में तकलीफ होना, ये होना ही है, जिंदगी भर सो के रहना पड़ेगा, ऐसा उनका
in a vegetative state.
Yes.
Yeah.
So that was far back when we didn't have microscope, we didn't have MISs for that matter. And I would say the correct indication, like I said before, MRI matching with the clinical symptoms, the availability of the equipment, of course, the setup and the surgeon's experience. If these all fall in place, you are most likely to have a good result, and you should not be worried for that, I must say.
So go ahead and get it done if you require.
Yes, exactly.
One, right? Just make sure that you are on the right hands.
Yeah.
So
it should be an informed thing because lots of media bombarding from either WhatsApp University or the print media and other things, half-hearted things are people catch only the half-hearted things, and
so
they do not
get to hear a lot of things.
Focus on the good part of it. Like हम हमेशा बोलते हैं कि किसी को कुछ in case problem हुआ तो पूरा गांव में जाके बताता है.
Correct.
किसी को अच्छा हुआ तो किसी को बताता नहीं, he keeps it to himself. So that is the I must say the bad luck of spine surgery because of the bad propaganda.
Yeah. So looks like you hear a lot of questions which are from this different. Yes. Internet channels and sources. So yeah, I think that is very common, and this message out there should be helping out people. So now quickly moving on to the next segment of this podcast, which is I read out some questions for you, and it might be a myth or a fact, or some short answers I'm expecting out of you. So I'm pretty sure that these myths are something which you have heard a lot of times.
Yes.
So let's shut them once for all. Okay. If you had to explain minimally invasive surgery in 60 seconds to someone, what would you say?
Right indication, correct patient selections, MRI clinical match, and a good setup with an experienced surgeon.
That's that. Okay. Can someone really go home the same day after spine surgery? I know it sounds too good to be true, but can they?
Yes, but it is, yes, definitely possible.
Is it?
Yes.
Oh my God. Okay. One word to describe spine surgery.
Just be fearless and take an informed decision before taking any step.
Okay. One spine condition you wish more people understood.
Multi-level spinal canal, lumbar canal stenosis.
Achha. Okay. Spine surgery is always the last resort. Myth or fact?
Myth.
Okay, so
it's not always, because if the patients directly present with deficit, it is the first I must say the first choice, not the last choice. Achha. Because if you get to pay the last aid, it may lead to a permanent deficit.
Yeah. Okay. Minimally invasive spine surgery is only for younger and fitter patients. Myth or fact?
Myth.
Okay, so we do it for even
yes.
elderlies also.
In fact, elderly also it is an advantage because less time of surgery, and less anesthesia, and faster recovery and other things.
Spinal fusions make you stiff forever.
Myth, definitely.
Okay.
It depends upon the level, the flexibility of the spine initially, how the patient behaves, and then post-op recovery, of course, post-op rehab.
Okay. All spine surgeries are high risk for paralysis. I think I know the answer, but still.
Myth, a big myth, in fact.
Okay, gone are those days.
Yes,
we can
exactly,
say.
Exactly.
With advancements like MISS,
Absolutely.
I think it's a long, old story. If my MRI shows a disc bulge, I need a surgery.
Myth. All discs do not need surgery. Like I said before, only 10% of them who have not been responding to the medical treatment or is a neurological deficit, only those are the patients who require surgery.
Achha. Recovery from minimally invasive spine surgery is painless.
Yes, it is painless.
Okay, absolutely painless.
Yes, it's absolutely truth and fact.
Oh, wow. So on that note, you have already explained, told us the story about the Limca records. Now tell us some story which really made you feel great about choosing this profession, and maybe some story which is very close to your heart.
Well, this was the most closest to my heart because she was a young girl and she was brought with extremely poor family and brought by her parents in a helpless state. And in spite of all the battles for life we had in ICU, she also had her parents and her relatives, all the other relatives also showed faith in us, and we were able to bring her out of life-threatening conditions. There are many, but was special to my, very close to my heart.
Okay. So how does, what's been the longest duration you spent in doing spine surgery?
We had a multi-level cervical spine coming up to the dorsal spine. It took about 12 to 14 hours for us, and we took a break. We were two of us. My colleague, Dr. Sufutani, was also there with me, and we took about 14 hours for that surgery. We had to take a break in between, but we were glad that he also went home walking on the 5th day of surgery.
Achha. So how does Dr. Rahul P. Modgi manages after a long tiring day? I've heard that you do some amazing yogas.
Yes.
So tell us about it.
I just like to meditate, close my eyes, and sit with me, and we look into myself inside.
Okay, so that's how you wind up.
Yes.
And you avoid a burnout.
Exactly.
Great, sir. It was lovely having you on today's podcast, and some great insights about minimally invasive spine surgeries. Is there anything else that you want to say today?
About
to
spine,
all the viewers?
Yes,
who are
about
listening?
spine I would like to say, like I said before, कुछ भी डिसीजन लेने के पहले खाली जो अपन पढ़ते हैं सुनते हैं उसके ऊपर रिलाई ना करते हुए एक स्पेशलिस्ट को जाके मिले, अपनी जो स्पाइन की कंडीशन उससे डिस्कस करें, MRI डिस्कस करें, उनके फैसिलिटीज़ फाइंड आउट करिए एंड उसके बाद में डिसीजन ले. वेदर यू रिक्वायर सर्जरी और नॉट, दैट इज अ डिफरेंट पर्सपेक्टिव. बट इफ यू नो योर स्पाइन, टू कीप योर स्पाइन हेल्दी, हाउ टू प्रिवेंट इट, फर्स्ट ऑफ ऑल, लाइक आई सेड, डायट, weight management and proper spine exercise, because spine ताठ कणा आपण मराठीत म्हणतो, spine flexibility and spine strength will lead to a long and healthy life.
On that note, informed decision and a right surgeon is all you need when you need a spine surgery. On that note, signing off, Dr. Tushita, Sahyadri Health Talks. Thank you.